So you're treating sleep apnea.
We are treating sleep apnea. You know, that's a whole nother giant population. Most people don't know they have it, but the ones that, you know, are discovering they have it, the first thing that the doctor does is they do a sleep study and they put them on a CPAP machine. Well, you know, CPAP machines are great. They help you, but nobody likes wearing them. Well, even the people that say they do, they say they'd rather not, but they wear it because it makes them feel better. And so from a dental perspective, we're the only people, a licensed dentist like myself, are the only people who can make a specially fitted sleep apnea oral appliance that you wear at nighttime.
But does it work?
It does work. Matter of fact, for people with mild to moderate sleep apnea, it's shown studies that it can do exactly the same thing as a CPAP machine. More severe cases, it can bring you down. Matter of fact, I'm gonna tell you an interesting story. Now, I work out, I run, all the stuff. I discovered I'm a severe sleep apnea. I couldn't believe it. And I have one of those devices myself. I just found out back in February of this year. In 6 months, and I redid my sleep study, it had improved me. I was at a 67, and that's a 30 or bigger is severe. I'm already down to a 40 points.
Okay.
Just in 8 months.
Okay, so people are breathing fine all day long, but when they lay down, they sleep, they can't breathe. Is that right?
Exactly.
So obviously there's some kind of a jaw, there's something going on. So you're saying that you make like a splint or an orthotic for the mouth? Is that correct?
Yes, it's called oral appliance therapy, and it's an orthotic. It's a device that fits in your mouth that repositions your jaw so that you have more tongue space. And what happens when you lay back, your jaw goes back.
Interesting.
And you might snore or not snore, but what happens is throughout the night you literally stop breathing multiple times. And we know that people that have this problem, they're at a 25% higher risk of a heart attack within the next 10 years. It's huge. High blood pressure, it causes obesity, diabetes. It's connected to all sorts of problems. So by just wearing a simple device that we custom make that repositions the jaw so you can get good oxygen at nighttime.
And you get the couple sleeping back in the same room again?
Yeah, that's another big thing. Usually wife makes husband sleep in another room. And so
because you can't sleep, obviously, if it's noisy.
Sleep. Yeah, it's noisy, or they're gasping for air all night long, and so they get back together. It changes relationships. There's a list of things that changes. So
plus, if you get a good night's sleep, you feel good the next day.
You feel good.
Energy's
you're not tired.
up.
Yeah, we have a simple little test. I think they can go on our website and take this test. It's called the Epworth Sleep Test. And there's a few simple questions, and if you answer a positive to more than 3 of those questions, the likelihood of you having sleep apnea is huge. And so what they can do, now here's another big deal. A lot of people don't like, they've had a sleep study, and I had a full sleep study, and I felt like a test monkey getting ready to get shot into space or something.
Okay.
But we have a very simple take-home sleep study that's highly accurate, so they can do it in the comfort of their own bed, at their own home, and we can get an accurate reading of where they are, and we can monitor it and show them how they got better.